You're watching Barnstable this morning. Joining me now is Diane Wolsifer. She is a psychiatric nurse practitioner, as well as Dan Gray. He is the operations director for VinFen. Both of you are co-chairs for an upcoming event, the Behavioral Health Summit. Tell me a little bit about this event.
Well, the summit invites speakers from all over to come and present new knowledge concerning behavioral health research and programs, and we've been doing it for this is our 4th year, and this year the focus is on the behavioral health across the lifespan. And so there will be some special breakout sessions on young mothers who are addicted to substances. They're all like at excellent times in a person's life to intervene and try and make things better. Also transitional age youth, which Dan is he's facilitating the panel, and the older adult behavioral health. So we're really excited about it.
Yeah.
Go ahead.
Oh, so yeah, the combination of the speakers and the breakout sessions we really think gives great knowledge across many different disciplines. And that's one of the things that we've been really proud of with our 4th summit, is that we're bringing people to a chance to network and to share information from many different areas of the Cape, and people providing different services, from pediatricians to primary care physicians to our outpatient clinics that are doing therapy, and outpatient providers. Diane works in the day hospital at Cape Cod Hospital, and so we have a lot of different people that are bringing information to share within the summit. The first couple of years we had some different themes that were really critical in moving our system of care forward, whether that be the idea of co-locating therapeutic services with behavioral, with primary care. We've done a lot with some of the substance abuse programs that are on the Cape. And one of the things that we were really proud of last year was that we had a panel including many of the police forces on Cape Cod, which has been one of our great relationships that have developed through the coalition. We do have monthly meetings, and we're really proud of the variety of people that have been able to come to those. So,
well, we know behavioral health is so important, and it really does affect so many aspects of our lives. So this is really something that people across disciplines really could be involved with. Who are you looking to get to come to this event?
Well, we like to think of the provider as anybody in the community who really cares about, it could be a family member or a neighbor who might also be struggling with mental illness. But we started as providers, licensed social workers. We have physicians coming, nursing, and EMS have taken quite an interest and are quite active in our coalition.
So many times there are first responders that are there right away, and they need some of these skills to help them navigate that situation.
So one of the things that was really exciting about last year is that we were able to raise enough funds that we are paying for police across the Cape to go to what's called mental health first aid. The first session of that is on Friday this week, where that's tomorrow, where the idea is to be able to have a different sense of the way that they're going into situations. And the police departments that have worked with us up to date really feel that it's key to being able to have a better understanding, because sometimes if somebody is in a behavioral health crisis, it might look much more threatening to the officer coming into a situation. And if they're trained correctly and appropriately to be able to handle that, there's a lot better outcomes, and there's been a lot of success with that.
They can spot those issues and maybe have some new different techniques to sort of de-escalate a situation rather than ramping up. So very important skills there. What do you think is different this year for the Behavioral Health Summit than maybe years previous?
Well, I think that we've always tried to have a slightly different track. So it's giving other information that is relevant to behavioral health treatment. So as Diane mentioned, the 3 tracks, or the 3 breakout sessions this year, are really targeting a specific point in somebody's life cycle. whereas in past years it's been a little bit more generalized about healthcare as a whole, as opposed to kind of these specializations.
What are the different tracks or the different segments of life that you're looking at?
This, we have 3 that we're looking at. One is, I think I mentioned it earlier, it's one program called Moms Do Care. It's where, and it is funded by SAMHSA at Cape Cod Healthcare, where they focus on young mothers who are addicted. They're a very vulnerable population. They feel judged wherever they go, and it's an excellent time because most of the times they do really want to turn their life around at this point and take care of their child. Transitional age youth, another excellent time to intervene in a person's life who's struggling, to get them focused on employment skills and hopefully schooling. And then the older adult, where family caregivers might be struggling with caring for somebody in the last stages of life, or just chronic illness.
So to piggyback on one of the questions that you had said earlier about who are we targeting for this, really anyone. One of the tenets of recovery from mental illness is that everyone is part of somebody getting better. That it is no longer just, okay, I'm an expert in this field, I'm going to tell you what you need to do to get better. It's about the person embracing their journey of recovery, and any of the supports and resources that are available to them are really going to be important to move forward. So, being able to expand that and take the stigma away from mental illness being in the shadows and being something that people don't talk about, we really want to have anybody be able to have access to this information, because all of us are affected by someone in our lives, whether it be ourselves or others that suffer from mental illness.
And let's face it, because of that stigma, there may be not a lot of opportunities to sort of reach out or seek that help. So if you have people in your life maybe scattered in different areas, like a teacher or someone you look up to, someone you admire, all different aspects, like a physician, your general practitioner.
Exactly.
So all of those different areas of your life, sort of, if someone has experience in this field, they can guide you, direct you where to go. Really important to notice those signs and to catch it.
And that's one of the things with transitional age youth. A vast majority of severe and persistent mental illness begins often between the ages of 16 and 25, is often the onset of the illness. So that's a really critical time for all of us, that we are exploring our own view of ourselves during that time. And if that is interrupted, it really makes significant difficulty for anybody experiencing the first onset of that.
And if anyone's watching and thinking, this is really something that I should attend, I really want to attend this, we should also let them know it's very low cost, very affordable to attend. It's a one-day seminar. And if you are taking it and say you're a registered nurse, this would also provide you some of those CEUs or CME credits.
Right. Exactly.
Yep, so the cost is only $60. It includes lunch, which is always a bonus.
It's a bargain.
Yes, exactly. So physicians, nursing, licensed clinical social workers, licensed mental health counselors, and EMTs all have continuing ed credits that they're available to receive through the...
Now, will you also have some organizations, Cape organizations, that will talk about the services that they provide at this event?
Well, there are going to be tables for some of the sponsors that are going to have information that are there. We're also going to have an open table where anybody can put materials relevant to their agency, and there's just a lot of great networking opportunities. One of the things that I've enjoyed in years past is the opportunity to be able to talk to people that you don't get a chance to just chat with all the time. Our coalition meetings, again, the last Thursday of every month, are great, and we do have opportunities to network there, but over lunch at the summit, there's a little bit more time where we're all running around a lot. So sometimes after the coalition meetings, everybody kind of scatters. So it is a great opportunity. There are kind of open times to be able to have more of that networking.
I love those times when you can really get together with people in your field, compare notes, what has worked for you, what issues you're finding, and help each other solve some of the issues. Or the back and forth is really important, I think, in growing.
It's great. And so many times in this field, you hear somebody's name many times from patients, and you never get to meet them face to face, and this is a great chance to, and through that you have no problem calling them up and saying, listen, I'm struggling with a mutual patient, and work together to make their life better and more tolerable.
So important, I think, as we make our way. If someone's watching and saying, this is perfect for me, how do they find more information, or how would they sign up?
The best way is probably to go to our website. It's on the screen. Also, the Barnstable County website has a link to our website. So
if you type in 4th Annual Behavioral Health Provider Coalition of Cape Cod Summit, something will come up to be able to get you into what you need.
Wonderful. Well, thank you both so much for joining me today to tell us all about the Behavioral Health Summit that's coming up. Really appreciate it, and wish you the best of luck.
Thank
you so much.
Thanks for having us.
Of course, my guests this morning were Dan Gray. He is the Operations Director for VinFen, and Diane Wolsifer. She is a psychiatric nurse practitioner. For Barnstable This Morning, I'm Sarah Mantle.